you get it from ticks, or I guess that's one way of getting it, and that can be fatal.
I know you can get it from ticks.
Transmitted by deer, and that's about it. Hallucinations possibly, but I wouldn't know how to identify that I had it aside from possibly a ring around a tick bite.
I have a vaccine for it, but you have to treat it early enough, and if you don't treat it within so many days, you can get long-term effects from it.
One afternoon in late September, my son Matthew had come back home from school with a fever and chills, and I felt he had swollen glands, so I just made him some soup to help with what I thought was some flu-like virus. After maybe 2 or 3 days with these same symptoms, I noticed that he always seemed to be scratching at the back of his knee. I made him show me the back of his leg, and I saw a huge bullseye rash. I had no idea what to think at this point. I immediately took him to the doctor, not knowing what to make of these flu symptoms and a strange rash. Without much hesitancy, the doctor diagnosed Matthew with Lyme disease. I had never even really known what it was, only that it had something to do with ticks. He said that we should still run some tests, but all of his problems made it seem like it had to be Lyme. Luckily, Matthew was able to be put on antibiotics immediately, and he was feeling back to himself within a few weeks. If I hadn't noticed him scratching his leg, though, we would never have known to take him to the doctor, and chronic Lyme disease could have developed with much more issues. We wanted to make sure that none of his other friends had the disease, even though it's not contagious. After talking to some other friends of ours, we found out that 2 other boys had been diagnosed recently with the same thing as Matthew. We decided to call the school at this point to make sure that all parents were informed and looking out for their children. It wasn't until a little later in the year, when 5 other kids in the elementary school had been diagnosed with Lyme disease, that the school took some action, though. They began to think that it had to be from something that they all were exposed to, and noticed at recess was something they all had in common. The playground is right next to a large wooded area, and playing around this type of environment was most likely where the ticks came from. At a PTA meeting, we all began to discuss the possibility of the school having some policies that would help prevent this from happening anymore. We proposed educating the recess monitors about Lyme disease so that they could help to keep the kids away from the woods. We also wanted to have a dress code for recess, including long pants, long sleeve shirts, and closed shoes to limit the area that was exposed to ticks. We spoke with our doctor to get the most important information distributed to families in the district to help increase awareness so parents could start checking their children and even pets regularly. I was really lucky to have Matthew taken care of early, but knowing the problems it can lead to, I would never want to see another parent go through that kind of upset.
Lyme disease is a bacterial disease caused by infected ticks. High-risk factors include outdoor activities like hunting or hiking, or having a pet which can bring the disease home. There is no genetic predisposition in this disease. The tick must be attached to the body for at least 24 to 36 hours in order to transmit the disease. However, most people with Lyme disease do not remember having seen the tick because it's too small to be seen. On the other hand, most people with a tick bite do not get Lyme disease. The earliest symptoms of Lyme disease are similar to that of flu, like fever, chills, local itch, muscle pains, body ache. However, the typical feature of Lyme disease is the rash. It looks like a bullseye. It expands and has an area of central clearing. A patient who has a history of tick bite and who presents with the typical symptoms must be started on antibiotics without any further lab tests, because untreated Lyme disease can spread to the joints, brain, nose, and the heart and cause major complications. Here are some tips to prevent Lyme disease. Use insect repellents. Cover your skin adequately with clothes. Avoid walking in high grasses. Check yourself and your kids and pets after being outside in the woods. To remove a tick attached to the body, grasp it close to its head using tweezers Pull it straight out with a slow and steady motion and make sure that its head is not embedded in the skin.